Good afternoon, YouTube viewers. I want to discuss Invisalign versus regular braces. There's not a lot of people with experience in, having both. Unfortunately, or fortunately, I've had the pleasure of having both. Right now I'm doing the standard braces. Unfortunately, Invisalign doesn't really work in all situations, and it has limitations. And some medical professionals out there may not inform you of what the limitations are. I just want to discuss some of the pros and cons of Invisalign and traditional braces, and some of the limitations that traditional braces have, and what, you might be able to treat with regular braces versus Invisalign. There are definitely some limitations, and you might find yourself making a $4,000 mistake and wasting 14 months. I'd like to discuss, Invisalign. I had it for 14 months. 19 trays on the top, 29 trays on the bottom. It doesn't correct certain things. What can it do? Well, it can't rotate molars. And it can't correct severe crowding, overbites. It has limitations. Reading my notes over here that I've written about it, and I wish I had done some research, before getting into the Invisalign, because I hadn't done some research, and I went to a general dentist for my Invisalign treatment, which is something else we'll discuss here in a minute. You want to make sure you're seeing an orthodontist. That's all I'm going to say about that. But let's talk about some of the pros of Invisalign. You have no food limitations, obviously, when you have Invisalign. You can eat whatever you want. You don't get I think it was a list. It was called the no foods list or something like that, and it's a pretty extensive list of foods that you shouldn't eat. I do. A lot of people do. But you could break the braces, and you don't want to do that. Just slows up the process. Brushing and flossing in particular is a pain. It's very difficult to floss until you get the hang of it, but it's much more time consuming than not having anything in there. So one of the pros is with Invisalign is you don't have those limitations of the flossing that you get with traditional braces, so that's not a problem. And there are no wires poking you. Especially when you first get them on. The wires, they tend to poke you. It's irritating. Some of the cons are there's more frequent pain. People ask about the pain level. Well, for me, in my experience, the pain level is about the same. But the difference is when you go to your orthodontist for traditional braces, you're getting, adjustments, new wires and ligatures replaced about 4 to 6 weeks. With Invisalign, you get usually you see your orthodontist or dentist, usually every month, but he gives you usually at least two trays. And you swap them out every 2 weeks on average. Your treatment may vary depending on who you are and what your needs are and all of that, but usually every 2 weeks you feel that pain. The pain is the same, but it's more frequent because now instead of every 4 to 6 weeks with traditional braces, you got pain every 2 weeks. And let me tell you, it hurts. There's a considerable amount of pain when you pull the trays out to eat, which is another disadvantage. You have to pull the trays out, and you need to brush after. You're supposed to wear the trays 23 hours a day. You may hear different things, but you want to keep them in your mouth as much as possible, or they're not effective. And what you'll find is if you don't keep them in your mouth, then enough, then they won't fit. It'll slow up your treatment, or it'll completely mess it up. And another disadvantage is if something does go wrong, and you need to, they're not fitting her for whatever reason, You may need to have molds redone, and you may need to send it back to the Align factory, which is time consuming. It's in California. So that's a definite advantage, or disadvantage rather, to the traditional orthodontics over the Invisalign. So there are some definite cons. I also find that the braces, the regular metal braces, are much quicker than the Invisalign. That's my personal experience. And the trays can break. I did have one break on me, so you're not immune to that. And if you don't clean them, they will smell bad and they will become discolored. My recommendation is to take a little mouthwash. It won't hurt it. Soak the tray in there while you're eating, and then pull it out with the mouthwash. Do this, at least a couple times a week, every other day or whatnot, and then brush it off and rinse it real well. That'll help minimize the discoloration and it'll, definitely help with the smell as well. They're sitting in your mouth all the time, so I tend to think that the Invisalign feels less comfortable in your mouth. Now let's discuss some of the standard braces. Really, there's not many limitations to what they can fix. With braces, other than surgery. Some bite issues with people over, as adults over the age of 15. You may need jaw surgery to fix the problem. But the braces do have limitations. All types of braces. It can fix more difficult cases, it can fix bite issues, and you can use other appliances with the braces that's less common with Invisalign, like elastics. Some of the cons that I do find with the regular braces, and there aren't too many really. I think they're more comfortable and there's less pain. But there are food limitations. You get the no foods list, and you can definitely break stuff. They're ugly looking is one of the huge cons that I find. And that's why I did, initially I didn't want to go with traditional braces because of the appearance and, not being a teenager anymore. That's not really the look that you're going for. Flossing and brushing is definitely, hygiene is more difficult. But other than that, there aren't really too many limitations to it. My recommendation is to get at least three consultations. Make sure they're orthodontist consultations as well. Don't be sucked in by a dentist that doesn't offer the Invisalign, or does offer just Invisalign, but doesn't offer traditional orthodontics. They might be more apt to push the Invisalign to get your money rather than to offer you what's best. So make sure I would say at least 3 consultations. Make sure they're orthodontists and not just dentists. And they may not tell you, so you may want to ask. Another good thing to ask is, if you do go with Invisalign, if the Invisalign doesn't work for me, will you do traditional braces after? If so, how much will it cost? Maybe they can, if this dentist or your orthodontist is so confident that they can fix your issues, then he or she should be willing to fix it for free, right? With regular braces after. You've already paid the money. My final thoughts on this are standard braces I find them to be better. I wish I had done them to begin with. They're actually more comfortable. They work a lot quicker, I can tell you that. And there are some limitations to it, but overall I'm more pleased with the traditional braces. But that being said, if you have some minor crowding issues, the Invisalign is good for closing gaps. It's good for pushing teeth forward and backwards, and for correcting minor crowding issues and such. So it's a good product. It did straighten my teeth quite a bit. But you know, it didn't finish the job. In fact, it left quite a bit of work to be done. 1.5 years of traditional braces is how much work needs to be done. In addition to work needing to be done from before, it also created new work. My back molars do not touch now. I will need to utilize elastics, I'm told, at the end of the treatment to rectify the problem. Other issues that it left is some crowding on the bottom teeth. From before. Some of the teeth, my teeth were quite bad on the bottom. They were overlapping, and you know, it did make huge improvements, but it didn't, like I said, it didn't fix the problem. It doesn't fix many bite issues. Overbites, I have an overbite. Now with regular braces, I can minimize the overbite. Invisalign didn't touch it. Being over 15 is the typical age. You know, my jaw has stopped growing, so it would be difficult to correct the problem completely without jaw surgery. But these are some issues that should have been taken care of. If you're a young person watching this, do the braces when you're young. Learn, I made a mistake by not doing that. Get it done with. It'll be quicker, and you'll be able to correct more issues. You don't want to have to deal with surgery. It's not a good situation. I opted not to do that. It's not been recommended. But the traditional braces have done an excellent job so far. I'll keep everybody on this channel up to date on that. I'd like to post some pictures, maybe at the end of this video. I haven't decided yet, on before and after pictures of my teeth and the Invisalign trays. And if you have any questions, please feel free to comment down below. Ask me the questions. I'll be happy to get you the answers. And yeah, for now, that'll be all. Thank you out there in YouTube world.